The Centers for Disease Control and Prevention confirms this is the first U.S. death from measles since 2015. Texas is experiencing its largest measles outbreak in nearly 30 years. The state's health department saying the unvaccinated child died in the city of Lubbock.
The best way to prevent measles is to get vaccinated against measles.
Dr. Michael T. specializes in pediatric infectious diseases at Advocate Healthcare. He says measles is a highly contagious airborne disease, and symptoms generally include a high fever, cough, red, watery eyes, and a rash of red spots on the body. He says getting vaccinated is the best protection. The vaccine typically given to young children, the first dose at 1 year of age, the second around age 4 or 5. TKIP says if you've never been vaccinated, even as an adult, it's not too late.
You can get vaccinated from measles and prevent measles from developing even as late as 3 days after exposure to measles.
Robert F. Kennedy Jr., the nation's top health official and a vaccine critic, said that the U.S. Department of Health and Human Services is watching cases, though he did not provide specifics on how the federal agency is assisting.
It's not unusual. We have measles outbreaks every year.
Several measles cases have also been reported in New Mexico. Officials say there's no apparent link between the outbreaks, but experts warn more cases could be on the way in other parts of the country.
It's not a question of if, it's a question of when we will see more measles cases popping up around the United States. Since the pandemic, we've seen vaccination rates slowly decline.
Dr. T. says there are currently no measles cases in the greater Chicago area. The last case was nearly a year ago.
Watch breaking news on YouTube. Subscribe to ABC7 Chicago Eyewitness News.